facial artery branches, but not about minor illness syndromes. What are the minor illness syndromes? Common cold, feverish cold, flu-like illness, sore throat. And for all these things, today we go to a hospital doctor and get so many medicines or television advertisements. सिर में दर्द है, हाँ यार, ये भी है, हाँ हाँ यार, और भी ये है, हाँ हाँ यार, तो 5 दवा लेना, एक नहीं. Take these 5, and it swallows that, and immediately the whole thing becomes normal. So you believe that. Actually, these are all. It was Harvard University, one Professor Simon, who showed that our old granny's ginger is the best antiviral drug. Ginger, pepper, and garlic together will probably solve most of these problems without any side effects at all. Last but not the least is the commonest thing that you get is a sore throat. And you go to a doctor and take an antibiotic. An antibiotic spoils your health. But you would be surprised to know that the best treatment for a sore throat is hot water sip. You sit quietly, take a mug of hot water. If you want, put a little lime in it to make it tasty, and keep on sipping for about an hour. When your throat becomes 1 degree centigrade higher, the viruses die and you are okay by afternoon. So simple. And all this is because we have wonderful treatments in other systems also, which we say do not have evidence base. Now we know the evidence base of Western medicine is evidence manufactured. I told you how fat became an evidence for heart disease. Similarly, all other medicines are like that. So all these things you have to spread now. So all this, I do an average every week at television view, and I do 1 or 2 YouTube videos. So all these go around, and now I got statistics say I got about 5 million people in the world who are influenced. I get calls from Australia, America, China, everywhere, and I get consultations on the YouTube, on email from all these places. Because I'm free, I'm doing this free, I just can't cope up with it because I get about 200, 250 email consultation requests every day. And people have a myth that saying that I don't have to see the doctor, my reports can be seen by the doctor. So I always tell them, I have got a set written. I have not learned how to treat reports. I have learned how to treat a human being. And I don't believe in disease, but I believe in the patient. Hippocrates said, know thy patient more than his disease. And when once I know the patient, it's very easy to treat, because supposing I have a headache, I don't have to go for a tablet. I know if I know the person very well, and if I know that he and his wife are not getting on very well, I just have to pat him and say, why did you fight with your wife yesterday? Just take it easy, the headache will go. And I had a patient, a very important man in India. If I told his name, you'll all now stand up. This man keeps seeing me every time I go to Chennai with, I have a small headache here. Yesterday again he came. He is 94. And he said, I have a small headache here. So I told him, dear sir, because you have a head, there must be an ache. And I have a treatment for that. He said, he is a colleague of our CNR Rao and all. So when CNR Rao got the Nobel Prize, what is it called? Bharat Ratna Award. This man did not get it. After that, the headache started. So I said, I would, if I have the power, request the government of India to give you a Bharat Ratna or whatever, Bharat Ratna or so, your headache will go. He laughed. And his assistant told me afterwards, sir, ninge satyama sonninge. This is exactly our view also, but we can't tell it because he's a big man. That's the right treatment. So yesterday again he came. So I told him, don't you worry, nothing will happen. Your head is all right. And he has said all things, CAT scan, dog scan, PET scan. And each time he goes to the doctor and says, I have a headache, they scan his head. And I said, at this rate, you will have a cancer in the head because you have been scanning so many things. So this is the story. So if I know the person, I know the treatment, which doesn't require medicines. My suggestion is you require as less medicine as possible. Life is very good. I had a stroke recently. I followed all the rules of the game to lead a healthy life. But one day I was lecturing like this in a college for about 2.5 hours. I was standing lecturing. After that, I went for a meal. Then I found my leg was a little weak. And there's a story started there. But anyway, I recovered, thank God. Let's cut the long story short. I've written an article about it. It's called Autopathographies. I've written how it happens and why it goes. All this is because it's in the mind. Ultimately, the mind is the seat of all the disease. And mind has to be corrected. So I was telling that scientist yesterday who saw me for a headache, I said, sir, we have all the gadgets, but we don't have a mindoscope. If you can get into your mind and see, decipher your mind, your headache will have gone. He said, yes, mindoscope, that's a very good idea. எங்க சொன்னீங்க? Then I said, no, சொல்லல, இப்பதான் ஆலோசனை பண்ணேன். உங்களை பார்த்து தான் ஆலோசனை பண்ணேன். See, that's how it happens. But mind you, this is very difficult to change. Change is difficult, very difficult. But these days we are better off. When in the 18th century, Simmel said, doctors don't wash their hands and that's why patients die. That other doctors thought he was mad and he was put into the mental hospital and he died there. But thank God, they have not put me into the mental hospital, though they wanted to. When I first wrote 40 years ago, I wrote a book called What Doctors Don't Get to Study in Medical School. Such a bad review was there in Indian journals. They said this man is mad, he doesn't know medicine, he has to be put in jail, etc., etc. But then after a week, the British Medical Journal wrote a review on the same book, which said this is not a textbook of medicine, but this is holy text of medicine written by a prophet. Then Indians changed. Then they said, okay, that book must be good. So the book is in several editions now, but that didn't change much. You know, the day I changed myself, I was a young man and had a lot of degrees and things like that, and I had lost my head, and I didn't know who I was. But one day, a young lady lost her husband at 2 o'clock in the morning, absolutely fit person who had a massive heart attack and died at about 2 o'clock. My juniors called me and said, sir, please come, this lady is uncontrollable, you come. So I went there at 2 o'clock in the morning, and I had not put on my shoes. I had gone in my chappals, walked into the ICU. This lady was rolling on bed, and she caught hold of my, with a big grip of my ankle, and asked one profound question. Doctor, why did my husband die? I thought for a while, my God, with all my lore, I'm a bloody fool today. I don't know the answer to this question. If she had asked me, how did my husband get a heart attack, I would have given her a big lecture on what the textbooks say. But when she said why, I didn't know. So I went out into so many things, from teleology to philosophy, and found that ultimately a Nobel laureate physiologist said, positive sciences never answer the question why. They answer at best how or how much. I as a doctor can say, how does the heart contract? But I can't say why does the heart contract. For to know why does the heart contract, you got to go to teleology. So that is where I went into Ayurveda, Unani, Siddha, and now I find all these systems are equally good. Then I found a study done in Thailand where there are 5 systems of medicine concurrently working in society. Western medicine, pure Chinese medicine, integrated Western Chinese medicine, Samoa system where the father tells the son what to do, and quackery. And the study after 5 years showed that all these people are equally effective as long as they had interest in the patient. So I always tell my students after that, whether you like homeopathy, homopathy, Ayurveda, or whatever it is, as long as you have empathy and sympathy, you are a good doctor. Now my slogan to my medical students is, be a good human being, you're a good doctor. Don't have to have any big degree, etc. Because patient must have faith in you. When once he has faith in you, that's called the placebo effect, you will get cured. So many people said, oh, what is this man talking about? When I get bypass surgery done, it's bypass surgery done on me. So where is the placebo effect? My former chief in Harvard did a very good study. 600 people over the 5 years were sent for bypass surgery to Harvard Medical School. And he examined them and found none of them needed bypass surgery scientifically. But then they have come, they have paid the money. Anyway, the hospital has received the money. So we had 2 theaters, theater A and theater B. And he sent the patients blindly into 1 to A, said 2 to B. And the protocol in A was anesthetize, operate, send. Because those days we were doing with the laser beam, so you don't have to cut the chest. And B was anesthetize, keep him sleeping. When he wakes up, tell him he had a wonderful operation, send him home. And now after 10 years, they found that those who went to theater B had nothing. They were all normal. Their blood supply had come back to normal. Their scanning had become normal. But those who went to A, half of them did not get relief, so they had a cut open surgery. The other remaining half of them were in heaven with their maker. The remaining half are suffering from the drugs that they're receiving. So the conclusion was, Even bypass surgery is a placebo effect. And in India, it is definitely a placebo effect, because after having paid 10 lakhs, if you don't get a placebo effect, you are not a human being. So, friends, change is a must, because knowledge, said Karl Popper,